Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day.
Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders. This show is presented by CNS Healthcare. My name is Kara Johnson, Marketing and Outreach Manager, your guest host today. We want you to know your mental health matters and it's okay to not be okay. Today's guest is Rita Dinser, Infection Control Nurse at CNS Healthcare, who will be talking to us about the importance of vaccinations. Rita, thanks for being our guest. Please tell us a little bit about yourself and let's dive right in.
Okay, thank you for inviting me. My name is Rita Dinser, an infection control nurse for CNS Healthcare for 2 years, and I've been with infection control for over 7 years now.
Rita, let's kick off. Why is it important for everybody to get a flu shot this year?
This year is especially important because we are experiencing a tridemic, RSV, flu, and COVID all coming at us at once. It's important also because we have reduced population immunity. So many of us were, isolated or within our pods. We were out in large crowds. So we have that reduced immunity. And many kids have never experienced the flu or been vaccinated. So it's really important.
What age does the CDC recommend people start getting the flu vaccine?
The CDC recommends ages 6 months and up. And this year, we really want to push it because they're finding that RSV is actually mutating with the flu virus, the influenza A. A lot of kids are already, showing up with RSV, and the pediatric hospitals are being overwhelmed. So we really want to get that in. And it is possible to have 3 viruses at once. So we don't want that.
Yeah, definitely not. It's not a good way to start your 2023.
Exactly.
Rita, other than getting the flu shot, how can people lower their chances of getting the flu?
It's the age-old stuff. Continue to wash your hands. Try to keep your hands away from your eyes, your nose, your mouth. Make sure that you're cleaning surfaces during the day that are highly touched. If you have to be around people who are sick, make sure that you're washing your hands again before you touch any parts of your face. And just try to minimalize. If you're going to a crowded area out in public, I would still recommend wearing a mask. Especially important right now.
Rita, what's new with the 2022-23 influenza vaccine recommendations?
This year, they're recommending that they actually start at 6 months. They're recommending that people ages 6 months and up are getting the new flu vaccine that has an influenza A in it. For those over the age of 65, they are recommending that they get the quadrivalent, the higher dose. And we want everyone to be vaccinated. September is the starting time, but definitely by October to get the maximum benefit from that flu shot.
Appreciate that, Rita.
Mm-hmm.
If you're just joining us, this is Bright Spot, your community connection to wellness presented by CNS Healthcare. We're speaking with Rita Dinser, RN, about the importance of vaccinations. Rita, let's shift topics a little bit over to COVID-19. Can you tell us where you can get COVID-19 test kits and why it's still important for people to be testing?
Absolutely. It's important because right now with this tridemic, it is very difficult to tell the difference between whether you have RSV, the flu, cold, or COVID-19. There are a lot of areas where you can get free home test kits. You can get them from local pharmacies. If you have insurance, you are allowed 8 per month. You can get them from Project ACT. If you Google Project ACT, it shoots you to a screen. You just have to put in your zip code, and then you'll receive kits within 1 to 3 days. You can also get them from local libraries. All Detroit libraries carry them. For your local library, you might want to call ahead of time to see if they have any in stock. And for our people who use Genoa, they also give out free test kits.
We always hear a lot about the COVID variants. Can you tell us what the current variant is, and then what it means to have different variants of COVID and why we should be paying attention to that?
Sure. Currently, we're experiencing more BQ1 and BQ1.1. It's so easy to get confused because we have other variants out there. There's BQ4, there's another BQ4.1. All of these variants are still in the family members of the Omicron. So basically, it's still out there, Omicron. So the new bivalent vaccine is very effective with those, all of them so far. And another reason why we want to promote those bivalent vaccine boosters. Please get your booster. If you have COVID series 1 and 2, that's wonderful, but you really do need that extra bivalent to keep you safe from the Omicron, which is really speeding up now.
Rita, I think a lot of us have talked to or know somebody that's still not sure about the COVID-19 vaccine. They're a little hesitant. They're not sure if it's safe, how it's going to impact them. How would you talk to somebody who's a little bit unsure about getting the vaccine?
First of all, I would listen to them. I'd listen to the reasons about why they don't want to get the vaccine. I would try to encourage them by telling them reasons why they should. For family safety, for their own safety, to prevent them from dying or becoming extremely ill from COVID. But it's a long journey for some people, and it has to be done in a positive manner. We should never condemn them for their opinion, but just try to help them understand why we think it's important.
After listening to this discussion, if someone's decided, all right, it's time for me to go get my flu shot or my COVID booster, where's the best place for them to get that?
You can get those usually at your local pharmacy. You can get them at your local public health department, but you can also find areas that are close to your home by Googling vaccines.gov. That will work. You can also text on your telephone 438829, and you put in your zip code and it will tell you all of the places that are close by.
Is there anything else you'd like to share with our audience?
It's going to be a rough winter, and the best protection is your vaccines, washing your hands. If you're going into a crowd, wear a mask. If you have to be with people who are sick, make sure that you're taking care of yourself, and make sure you're eating well, exercising, and getting rest.
Thank you so much, Rita, for joining us and for sharing all those tips. And thank you for watching us today on Bright Spot, CNS Healthcare's virtual show. We hope you'll continue to mark your calendars and join us the second Monday of every month at 12 to discuss feelings, struggles, and finding one's way. If you have a topic that you'd like to hear discussed, please drop it in the chat or comment on this video. Remember the next month to be a bright spot. You never know when a smile, a compliment, or a kind word can really change a person's day. Have a great week.